How does testicular ultrasound determine benign or malignant growths? Imagine feeling a lump in your testicle and wondering what it could be. Doctors use a special imaging test called a testicular ultrasound to help find out if it's benign or malignant. This test uses high-frequency sound waves to create detailed pictures of the inside of your scrotum. It's a safe, non-invasive way to look at the testicles and surrounding tissues. The process starts with a small device called a transducer that sends sound waves into the scrotum. These waves bounce back and create images that show the texture and structure of the testicles. Normal testicles look smooth and uniform on the ultrasound, while abnormal areas like lumps or masses appear as different shades of brightness or darkness compared to normal tissue. One of the key things the ultrasound looks at is where the mass is located. If the lump is inside the testicle, it raises concern for cancer, as most testicular cancers are found within the testicle itself. If the lump is outside, it's more likely to be benign, like a cyst or other non-cancerous growth. Next, the ultrasound assesses how the mass looks. Malignant tumors often appear as solid, dense areas that are darker or lighter than the surrounding tissue. For example, seminomas, a common type of testicular cancer, usually show up as uniform, darker masses. Other types, like non-seminomatous tumors, tend to be more mixed in appearance, sometimes with cystic or calcified parts. Benign cysts are usually simple, dark, and have clear borders, making them easy to identify. Doppler ultrasound is another important tool. It measures blood flow within the testicle. Cancerous tumors tend to have increased blood flow because they grow new blood vessels to supply themselves. If the ultrasound shows lots of blood flow in a mass, it suggests a higher chance of malignancy. Benign lesions generally have normal or no increased blood flow. The ultrasound can also reveal other features like calcifications or cystic areas. Calcifications can be present in both benign and malignant growths but are more common in some cancers. Cystic parts, which are fluid-filled, might indicate tumor degeneration or necrosis, often seen in malignant tumors. Simple cysts are usually benign. Size and growth over time are also clues. Larger or rapidly growing masses are more suspicious for cancer. The ultrasound's high sensitivity and specificity mean it's very good at detecting potential malignancies, but it cannot confirm cancer on its own. It guides further testing. If the ultrasound suggests cancer, blood tests for tumor markers such as alpha-fetoprotein, human chorionic gonadotropin, and lactate dehydrogenase are performed. These help support the diagnosis and classify the tumor type. Usually, the next step is surgical removal of the affected testicle, called an orchiectomy, which provides a definitive diagnosis. In summary, a testicular ultrasound helps determine if a growth is benign or malignant by examining its location, appearance, blood flow, and other features. This information, combined with blood tests and clinical evaluation, helps doctors decide the best course of action. If you notice a lump or have concerns, always consult a healthcare professional for personalized advice and appropriate testing.